Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, why does the ICU team say that my mum has limited time on a ventilator? You can check out last week's question by clicking on the link below this video. In today's episode of Your Questions Answered, I want to answer questions that we get quite frequently as part of my one-on-one consulting and advocacy service, and that is relevant for this current time, and it's COVID and children. Children can get coronavirus or COVID-19, but they seem to get it less often than adults, and it's usually less serious. Children of all ages can become ill with coronavirus disease 2019 or COVID-19, but most kids who are infected typically don't become as sick as adults, and some might not show any symptoms at all. While all children are capable of getting the virus that causes COVID-19, they don't become sick as often as adults. Most children have mild symptoms or no symptoms at all. According to the American Academy of Pediatrics and the Children's Hospital Association, in the United States, children represent about 10% of all COVID-19 cases. Research suggests that children younger than ages 10 to 14 are less likely to become infected with a virus that causes COVID-19 compared to people aged 20 and older. Hospitalization rates for children are also much lower than for adults. However, if children are hospitalized, they need to be treated in the intensive care unit as often as hospitalized adults, according to research from the Centers for Disease Control and Prevention, CDC. In addition, children with underlying conditions such as obesity, diabetes, and asthma are at higher risk of serious illness with COVID-19. Children who have congenital heart disease, genetic conditions, or conditions affecting the nervous system or metabolism are also at higher risk of serious illness with COVID-19. What COVID looks like in kids. It does appear that children are less likely to develop symptoms than adults. While children and adults experience similar symptoms of COVID-19, children's symptoms tend to be mild and cold-like. Most children recover within 1 to 2 weeks. Possible symptoms can include fever, nasal congestion or runny nose, cough, sore throat, shortness of breath or difficulties breathing, fatigue, headache, muscle aches, nausea or vomiting, diarrhea, poor feeding or poor appetite, new loss of taste or smell, belly pain, pink eyes, conjunctivitis. Most children with COVID-19 have mild symptoms or have no symptoms at all. However, some children can get severely ill from COVID-19. They might require hospitalization, intensive care, or a ventilator to help them breathe. In rare cases, they might die. Amongst children who develop a severe case of COVID, several risk factors have emerged. Those include obesity, diabetes, asthma, and chronic lung disease, having a suppressed immune system, congenital heart disease, and serious genetic, neurologic, or metabolic disorders. Why do children react differently to COVID-19? The answer isn't clear yet. Some experts suggest that children might not be as severely affected by COVID-19 because there are other coronaviruses that spread in the community and cause diseases such as the common cold. Since children often get colds, their immune systems might be primed to provide them with some protection against COVID-19. It's also possible that children's immune systems interact with the virus differently than do adults' immune systems. Some adults are getting sick because their immune systems seem to overreact to the virus, causing more damage to their bodies. This may be less likely to happen in children. How are babies affected by COVID-19? Although rare, children under the age of 1 appear to be at higher risk of severe illness with COVID-19 than other children. This is likely due to their immature immune systems and smaller airways, which makes them more likely to develop breathing issues with respiratory virus infections. Newborns can become infected with a virus that causes COVID-19 during childbirth or by exposure to sick caregivers after delivery. If you have COVID-19 or are waiting for test results due to symptoms, it's recommended during hospitalizations after childbirth that you wear a cloth face mask and have clean hands when caring for your newborn. Keeping your newborn's crib by your bed while you are in the hospital is okay, but it's also recommended that you maintain a reasonable distance from your baby when possible. When these steps are taken, the risk of a newborn becoming infected with the COVID-19 virus is low. Research suggests that only about 2% to 5% of infants born to women with COVID-19 near the time of delivery test positive for the virus in the days after birth. However, if you are severely ill with COVID-19, you might need to be temporarily separated from your newborn. Babies under the age of 1 year old might be likely to have severe illness from COVID-19. Other children, regardless of age, with the following underlying medical conditions might also be at increased risk of severe illness compared to other children. Asthma or chronic lung disease, diabetes, genetic neurologic or metabolic conditions, heart disease since birth, immunosuppression, weakened immune system due to certain medical conditions or being on medications that weaken the immune system. Medical complexity, children with multiple chronic conditions that affect many parts of the body who are often dependent on technology and other significant supports for daily life. Obesity. What is multi-system inflammatory syndrome in children, also known as MIS-C? This syndrome made headlines when it first began to appear among children several weeks after they'd had the COVID, and sometimes even when they hadn't COVID, but it's proven to be extremely rare. Multi-system inflammatory syndrome in children, MIS-C, is a serious condition in which some parts of the body, such as the heart, lungs, blood vessels, kidneys, digestive system, brain, skin or eyes become severely inflamed. Evidence indicates that many of these children were infected with the COVID-19 virus in the past, as shown by positive antibody test results, suggesting that MIS-C is caused by an immune system reaction related to COVID-19. Possible signs and symptoms of MIS-C include fever that lasts 24 hours or longer, vomiting, diarrhea, pain in the stomach, skin rash, fast heartbeat, rapid breathing, red eyes, redness or swelling of the lips and tongue, feeling unusually tired, redness or swelling of the hands or feet, headache, dizziness or lightheadedness, enlarged lymph nodes. Emergency warning sign of MIS-C include inability to wake up or stay awake, difficulties breathing, new confusion, blush lips or face, severe stomach pain. MIS-C is rare and most children who have it eventually get better with medical care, but some kids rapidly get worse to the point where their lives are at risk. The exact cause of MIS-C is not known yet, but it appears to be an excessive immune response related to COVID-19. Many children with MIS-C have a positive antibody test result. This means they've had a recent infection with the COVID-19 virus. Some may have a current infection with the virus. Many specialists consider MIS-C to be a complication of COVID-19. Without early diagnosis and appropriate management and treatment, MIS-C can lead to severe problems with vital organs such as the heart, lungs, or kidneys. In rare cases, MIS-C could result in permanent damage or even death. How is the transmission with kids? Scientists have been trying to pinpoint children's role in the spread of coronavirus since it first emerged. Research says that we need to assume that kids and adults are capable of transmitting the virus to other people. Because so many children don't show any symptoms, the idea that they could be unintentionally spreading the virus looms large. Researchers continue to examine the role children play in transmission. Recent studies show that children and babies as young as 8 months old have been shown to transmit COVID-19 to adults after outbreaks at 3 childcare centers, according to the Centers for Disease Control and Prevention. The findings come as schools and daycare facilities increasingly reopen to in-person contact, with the CDC continuing its research and guidance on controlling the spread of coronavirus. Researchers said that previous studies have shown children aged over 10 years could could spread the virus in schools, but this new study is clearer evidence it can be spread by younger children who don't get severely sick. COVID-19 is less severe in children than it is in adults, but children can still play a role in transmission, the CDC report says. The report recommended increasing testing, contact tracing and increased hand hygiene to reduce transmission. How to prevent kids from getting COVID. Monitor your child for COVID-19 symptoms every day. Pay particular attention to fever, temperature of 100.4 Fahrenheit or higher, which is around 37 degrees Celsius or higher. Sore throat, new uncontrolled cough that causes difficulty breathing for a child with chronic allergic asthmatic cough. See if there is a change from their usual cough. Diarrhea, vomiting or stomach ache. New onset of severe headache, especially with a fever. Keep track of who your child comes into close contact with. Take precautions to protect your child if you are sick with COVID-19. If you are sick with COVID-19, you can take precautions to help prevent spreading the virus to your child and others. And there are all the references for this article in the written version of this blog below this video. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of our website. Also, have a look at our ebook section, where you get more ebooks, videos, and where you can have one-on-one consulting and advocacy with me over the phone, via Skype, via Zoom, and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.